Oh, and welcome back to my channel. Let's start our genetic disorders. This is a continuation of the part 1 of the chapter genetics from the revision notes of MRCOG 1. So let's start. First is the type of the genetic disorders. The genetic disorders, they consist of the three types: the autosomal, sex-linked, and mitochondrial. Autosomal dominant and autosomal recessive are the subtypes of the autosomal genetic disorders. Now moving towards the autosomal dominant, the males and females, they affect the equally, and inheritance is 1:2, and the new mutations, they are common, and it has a feature of the variable expressivity and reduce the penetrance, and it includes the myotonic dystrophy, Huntington's chorea, achondroplasia, neurofibromatosis type 1 and type 2, and tuberous sclerosis, and the familial polyposis coli, and Marfan syndromes, osteogenesis imperfecta, polycystic kidney disease, porphyria, von Willebrand diseases. Now moving towards the autosomal recessive, both parents, they must be carriers, and inheritance is 1:4, which is 25%. It is not possible to trace autosomal recessive conditions via the family tree. It includes the cystic fibrosis, sickle cell disease, thalassemia, phenylketonuria, glycogen storage disorders, and congenital adrenal hyperplasia and Wilson's disease. Now the next is X-linked recessive. The inheritance is a 1:2. Sons of the carrier females, they are affected, and daughters of all affected males are carriers, and no males to male transmission. Shows a nice move pattern of the transmission such that any male grandchildren of affected female, they would be at risk. It includes the Duchenne muscular dystrophy, the Fragile X syndromes, and red-green color blindness, and glucose 6 phosphate dehydrogenase G6PD deficiency. So this is important, that no male to male transmission, and second, it shows a night move pattern of the transmission such that any male grandchildren of an affected male would be at risk. This is very important regarding the MC point of view. And for a few more are the Christmas disease, which is factor 11 disease, and hemophilia A and B, factor 8 and 9 deficiency, and neurogenic diabetic insipidus, and Leishman syndrome, and Wiskott-Aldrich syndrome, and A gamma globulinemia. Now, X-linked dominant. The inheritance is 1:2 offsprings of the affected females. They often manifest very severely in males, frequently leading to spontaneous loss of the neonatal death of an affected male pregnancies. It includes the incontinentia pigmenti, and the Reed syndromes, and the vitamin D resistance triggers. Now, the next is the mitochondrial. The mitochondrial DNA is inherited through the maternal line, because the sperms, they do not contribute to zygote beyond their nuclear DNA. Mitochondrially inherited conditions, they can affect the both sexes, but is only passed on the affected mother, and it includes the Leber's hereditary optic neuropathy and the Lake syndromes. Examples of the genetic disorders, it includes the tuberous sclerosis. It is a rare multi-system genetic disease that causes the tumors to grow in the brain and other vital organs. It is caused by the mutation of either TSC1 gene or the TSC2 genes. TSC1 gene encodes for the protein hemartin, located in the chromosome number 9, and in TSC2 gene, it encodes for the protein tuberin, which is located on the chromosome number 16. Hemartin and tuberin, they are suppressors of the tumor growth, and the features of the tuberous sclerosis includes the learning difficulty, epilepsy, cardiac rhabdomyoma, and renal angiomyolipomas, and skin manifestations includes the angiofibromas, which are the rash manifesting in the butterfly distributions over the nose, nasolabial folds, and the cheeks. And the hypomelanotonic macules, ash leaf spots, and the shagreen patches, which are discolored leathery patches of the skin, and the ungual fibromas. And the brain abnormalities includes the subependymal nodules and the cortical tubers. Next is the cystic fibrosis. It is the disease of the exocrine secretions and increase the chloride in the sweat, and prevalence is 1 in 2000, and the carries rate in the Caucasians is 1:23. and then it is caused by the mutations of the CFTR, which is a cystic fibrosis transmembrane conductance regulator gene. CFTR gene is located on the chromosome number 7, is produce a chloride ion protein which is responsible for the anion transport, and there are the over 1400 mutations that can affect the CFTR gene. The most common mutations of the CFTR gene is the delta F508 occurring in 70% of the cases. This is important. And chloride ion channel, they regulates the movements of the chloride ions from inside to outside of the cell and expect in the sweat ducts, and which where it facilitates the chloride movements from the sweat to cytoplasm. Hallmark of the cystic fibrosis, the viscid is excessive mucus production, and which blocks the ducts of the mucus secreting organs, leading to the recurrent chest infections, poor alveolar gas exchange, infertility, pancreatitis, the cirrhosis, and the intestinal obstructions. Malabsorption requires the supplementation with the fat soluble ADEK vitamins, and the osteoporosis and the diabetes. Infertility is due to the congenital absence of the vas deferens in the males and thickened cervical mucus in the females. Next important is the sickle cell disease, which is SPS. It is caused by the point mutation in the beta globin chains of the hemoglobin. Is due to the single base change, which is adenine GAG is substituted with the thymine CTG, and causing the glutamic acid to be replaced by the valine. The glutamic acid is hydrophilic and the valine is hydrophobic. The prevalence in the London is 1:500, and there are the two types, the homozygous HBSS and the heterozygous HBS. They cause the loss of the red blood cells due to the loss of elasticity and the sickling, and disruptions of the RBC membrane. They cause the short lifespan of the RBC, which is 10 to 20 days. Anemia is caused by the hemolysis of RBC. Bicycline rate of the hemolysis is more than rate of the RBC production. The complications we'll discuss later. And the types of the sickle crisis, they includes the vaso-occlusive crisis and the acute chest syndrome, which is the fever, chest pain, difficulty breathing, and the pulmonary infiltrates on the chest radiograph CXR, and the aplasia crisis, which are triggered by the parvovirus B19, and the splenic sequestration crisis, and the hemolytic crisis, which is common in the patient with the coexisting G6PD deficiency. The blood films, they shows the sickling of the RBCs, and they may show the features of the hyposplenism and codocytes and the Howell-Jolly bodies, and the treatment is the cyanide, which is irreversibly enables the sickling of the RBCs, and something to give the fetal hemoglobin productions, and then the penicillins and vaccines vaccinate for the encapsulated organisms, the Haemophilus influenza, the Streptococcus pneumoniae, and the Neisseria meningitidis, and the blood transfusion and the exchange transfusions, and the bone marrow transplant. Now the complications of the sickle cell disease, they include the infarction, the hyposplenism, and the autosplenectomy, and the emboli, stroke, pulmonary hypertension, and the ischemia, avascular necrosis of the head of the femur, and the chronic renal failure, and the hemolysis, the jaundice, and the cholelithiasis infections, the osteomyelitis, the overwhelming post-splenectomy infections, and in pregnancy, the fetal growth restrictions, preeclampsia, and miscarriage. Topic, which is a thalassemia. It is in reduced rate of the synthesis of the one of the globulin chains that make the hemoglobin, and the types are the alpha, which is production of the alpha theta chain affected, beta is the production of the beta chain affected, and the sigma is the production of sigma chain affected, and the E thalassemia is similar to the beta thalassemia, S thalassemia is similar to the sickle cell anemia, and the C thalassemia, it is prevalent in the Mediterranean, Arabs, and the Maldives, has the highest incidence of the thalassemia in the world, and the hemolytic consequences, the anemia in the thalassemia is due to the hypochromia, such that the lower intracellular hemoglobin and the excess of the unimpaired chain, and the lead to the cell membrane damage, and the reduce the RBC survival time. RBC morphological abnormalities on the blood film, they includes anisocytosis, poikilocytosis, microcytosis, hypochromia, target cells, and the basophilic stripling, and the fragment RBCs. Alpha thalassemia, the severity depends on the number of the alpha globin gene affected. There are the 4, and the silent carrier is the 1 gene affected. The trait is the 2 gene affected, associated with the mild hypochromic anemia, and but high drops when the four genes are affected is cause in utero death. Clinical features includes the tissue hypoxia and the hydrops fetalis. In fetus, the initial survival is due to the hemoglobin portland, and the fetal distress is noted after 12 weeks when the hemoglobin portland is replaced by the hemoglobin bars and the hemoglobin H and bars. They have a extreme high affinity for the oxygen and thus inhibits the delivery of the oxygen to the tissues. Thalassemia, the prevalence in the UK is 1:10,000, South Asia is 300, and Cyprus is 1 in 7, and has three classification: the major genetically homozygous for the beta thalassemia genes, and the minor the genetically heterozygous, and the intermediate genetically heterozygous. Clinical features includes fatigue, anemia, jaundice, shortness of breath, and the skeletal deformity due to the increased erythropoiesis, and the hepatosplenomegaly due to the extramedullary hematopoiesis, and the hematochromatosis due to the excess iron absorption from the gut, and delayed physical and sexual development due to the hemochromatosis. And infant born with the beta thalassemia will usually presents with the symptoms from the 6 months of the age, with the fetal hemoglobin is replaced by the adult hemoglobin. Treatment for the beta thalassemia major are the regular blood transfusions, the folic acid supplementations, and the vitamin D and the calcium supplementations, and the chelation therapy, ferrioxamine to remove the excess iron from the body following repeated transfusions, and the splenectomy, and the bone marrow transplants, and the cord blood transfusion. So here ends our first chapter, and I have already uploaded the part 1 of the SBS, and now we'll share soon the part 2 of the SBS, and we will continue practicing few SBS for of the genetics for few days, and then we will move to the next chapter. And hope you like the video. If you like the video, kindly share, hit a like, and subscribe to my channel, and to share it to your friends so that everybody learns. Thank you so much. Take care till the next time.